recording. Having said that, I haven't actually managed to get the previous recording made available yet, so that's still a work in progress. But I'm going to be taking notes in the background, so even if the recording doesn't work, we'll still have the record of the notes.
Awesome. Thank you for that.
Yeah, and I have got the previous recording, so it's not that it didn't work, it's just that I had like a plan to put it on YouTube, and that's harder than I thought it would be. So I've still got the recording, but it's just sitting in my cloud.
And it's all this tech stuff, isn't it, of just converting and downloading and converting again.
Yeah, it's a pain. It's a pain. Oh, we just lost. I think some of the internet connections on some people's side were a bit challenging. So hopefully they'll come back.
That's why I came into the office today. It's like I can't afford for my internet to cut out mid-presentation.
I know. That was my plan. And then I woke up and I was like, because I got another meeting straight after this, I thought, do I have time? And then I was like, yeah. So I'm going to go into the office a bit later, but I feel like that is a good plan to use the office Wi-Fi because it's usually a bit more reliable, isn't it?
My internet connection has been terrible as well. So fingers crossed, I'm okay today. The other day, my eyes were closed when it froze and someone went, "Oh, I did actually think you fell asleep." Thanks for that.
I can see we've just said a message. Yeah, so some people have got Wi-Fi issues. What I'll do is I'll keep an eye on the participants, and then when they come back into the waiting room, we'll just let them in. Yeah, because we lost both of them.
Oh, that's such a shame.
I might use this chance to try the screen share, if that's all right. We'll make sure it works while it's just us three.
Yes.
Oh, can I please have screen sharing privileges first?
Yes, I just realised that I had not done that. Yeah, so you should be able to share now, hopefully.
Thank you. All right. Can you guys see that?
Yes, perfect.
And it's the main view and not the presenter view?
Yeah.
It's perfect. It's the main one.
Good stuff.
I think you're the first person I've seen actually get it to the one that you want straight away.
Oh, no, that's a first for me as well. I don't know what luck just happened there, but...
Everyone goes, yes, we can see it, but it's not in the view you want. And then someone talks and you go, you're still on mute. I mean, I love it that we haven't got over that yet.
Yeah. Well, shall we get started? And then as soon as they, when they try and join again, I can just let them in. Carmel is, just come back.
Oh, perfect.
And cool. Diana. Hi for everybody just joining.
My husband's just come and gone, where's my coat? Because we had a party yesterday and I had to move everything. And he's looking for his scarf now. What's that? Yes, it is. Well, it's the one you're getting. He's like, bye, everyone. You'll be pleased to know he's found the scarf he wanted. It's only like 8:02 here. My day can only get better.
Yeah. I'm just submitting. Yeah, so I'll keep an eye on the participants, so don't worry about that bit.
Lovely. Looks like a lot of people are having the same issue that I have when I join, and it just takes a full 60 seconds to think and join properly.
Yeah, it looks like Diana's is still connecting.
What time is it for you, Carmel?
Over here, it's 10 a.m. It's 1 hour after the UK, I think, isn't it?
It's 2 hours at the moment because we're in
daylight, winter.
Daylight saving, which is the absolute bane of my life at the moment. We're trying to organise international calls because people are like, oh no, it's this difference to the UK. I'm like, no, because we're in this wind. No, because we're not in the wind. When we go back an hour, which is soon, will be the 1 hour.
We would have only 1 hour.
So we're still in our summertime daylight saving.
I think so.
Thing.
And Bonnie, but Bonnie's not joining from the UK.
No,
I'm from Australia, where it's 6 p.m. and we've just had our daylight savings the other way, so changing to summertime, and I'm the same. It's just messing with my head.
It's so complicated. Like when you Google it, it doesn't take that into account anywhere. I look at what the time is.
I put on the advert and have told everybody, yes, it's going to be 5 p.m. in Australia. And then somebody emailed me and was like, it's not 5 p.m. And I was like, how did I get it wrong again?
I didn't know.
Not your fault.
I didn't know Australia did the same thing. I thought we were the only people that did this ridiculous, weird.
You're right, because like Google doesn't tell you.
It's everywhere. It's everywhere because we have a 3-hour difference because in the summer, we add 1 hour, exactly like you. It's in all the time zones.
Okay, fine. It was not just us being peculiar. It gets complicated. So complicated. We need to have, there must be somewhere that's got a really good time zone, which takes into account for which month you're in and what is the time difference.
I would think so.
Because we changed the clocks. Kath, do you even know when it is?
It's soon.
Isn't it always on a Sunday?
Yeah, it's always on a Sunday, which
is that the same for you guys, Bonnie and Carmel? Is it always on a Sunday?
They usually
always like the first Sunday of October at 3 a.m.
Yeah.
And then, so it's fine for most people, but if you're a nurse or something like that and you're working, it just messes with you.
Yeah, so we haven't had
more.
ours yet. Ours comes at the end, I think it's towards the end of October. We like to do ours I feel like ours is at 1 a.m. I might be wrong about that. It's so strange.
Oh dear.
Right, and keeping an eye on the participants in the chat. So if you would like to go ahead, please feel free, and I'll just let people in as they join.
Thank you. Might as well get a wriggle on anyway, say my bit. So obviously today we're looking at the role of health literacy in health-related information seeking behaviour online, a cross-sectional study that was published in the Journal of Medical Internet Research. Before we get started, I just wanted to acknowledge the traditional custodians of the land that I'm calling in from today, the Wadawurrung people of the Kulin Nation, so that's on this little map here, and I just wanted to pay my respects to the elders past, present and future of Wadawurrung country, and extend that respect to any First Nations people here today, whether Australian, Aboriginal, Torres Strait Islander or First Nations people from other countries. So I just thought I'd put the abstract up for anyone that hasn't read it, and we can have a bit of a chat, give some other people time to have a quick skim of what it's all about. I also thought I'd just mention that I chose this article because it was published this year, but it's actually already been cited, I think, 3 times in other publications, which struck me as a fairly high number for something that's 10 months old at the oldest. So I figured it's one that's kind of been picked up and sort of threaded into that greater tapestry of how we sort of see health literacy as a field on the whole. So thought, love it or hate it, it's probably a good one to discuss. And I think it's had quite a few tweets and other things like that. So
that's really interesting. Bonnie, are you using it in your work at all? Are you citing it?
Not as of yet, but I have a few colleagues who work in like the real e-health literacy space, and they probably will be. And I'd say at some point, I don't know, I'm hoping there's higher quality stuff that I can cite in my work, but it's definitely one that made me do a lot of thinking. So thought it's probably a good one to bring to a group like this.
Yeah, that's brilliant.
Did anyone else have any like initial thoughts they wanted to share, or do we need a bit more time to read it, or?
God, I'm still on mute. I did have a question to ask around, it wasn't really a question, but I was thinking, I don't know what other people's opinions were, but I think they only collected data using the iPad. There wasn't like a paper format to do it. And then and I don't think it says, but I was assuming that they were giving it to the participant to fill in on the iPad. Yeah. So then that just brought up the whole thing of people that didn't feel comfortable doing that. And then we've missed out a whole load of people who aren't using digital technologies, who then haven't contributed to the survey as well. That was kind of the big thing that jumped out of me, that I was thinking, and I haven't read all of their discussions or limitations, so I don't know if that's comment. Is it discussed in the limitations at all, Bonnie?
No, and I would have liked to have seen some more info, because same thing as you. I thought, is this just an iPad that people can approach? Is it someone holding an iPad? What level are we working with here? Just give us something.
I totally agree, and I think that's quite difficult to make some of those comments on, because it was just at the fair, wasn't it? The Minnesota State Fair. Who is attending that? I've got no idea. I don't know who it's pitched at, if it's at families or who it's at. And then same as you are, I was imagining someone was stood with it, approaching people saying, can you do it? But it could just be stood there on a interactive kind of stand. You're totally right. So it would have been really useful to hear some more of those, the actual setup and how it was designed.
Mm-hmm.
And it seems to be strictly focusing on health literacy, right? Not digital health literacy and its relation to health-seeking behavior. Yeah.
Which I found an interesting choice. Are we all happy? Had enough time to read this? Good to move on? Cool. So this is the tool we're using. Thank you, Sam, for finding this gem. I really liked it, and hopefully everyone has the link, but don't feel like you can't talk about something just because it's not covered in this list. You know, we're all here to share our thoughts and hopefully kind of understand how we all see health literacy and online health behaviours and all those sorts of things. So, but I will bring the questions up on each slide just to keep things going. So what did we all think of the aims? I guess this is kind of where the rest of the study flows from. So did we have any initial thoughts on these? I can start if we want.
Yeah, go for it, Bonnie.
I thought they were clearly written compared to some other health literacy journals I've read that are really all over the place or use 50 words to describe one aim, and you're like, what am I even reading? I thought these were pretty easy to understand, but I would have liked a little more specificity. With that being said, like, even if they just named what population they were interested in, and even if that was just like the general population, just something there. And I did think it was a bit of a cop-out when they justified these aims by there's absolutely no literature looking at this sort of thing, because I think there is a fair amount of literature looking at this sort of thing.
Because also, and then at the end as well, they say, because it kind of ties into that, where there's a comment where it says something like, although this is not surprising. Well, if it's not surprising, then you've read something about it. So
yeah. So I don't know. I guess. Sorry, you've just muted yourself.
Brilliant. I thought the same as you, Bonnie, that they were clearly defined. We knew that there were 3 separate kind of areas that they were looking at, and the same as you, that it could be more specific to the population. And also, like Carmel said about we're talking about health literacy and not specifically digital health literacy, which is a really interesting point.
Any other thoughts? Keep it moving in that case, because I think the next one's going to be a pretty easy one. Are we all happy with it being cross-sectional? Yeah, I thought so too. I mean, obviously longitudinal's the ideal, but money doesn't just grow on trees to do longitudinal studies, otherwise we'd all be doing them. And the sample size. What did we all think of this? 614, but then 118 that were excluded from analysis.
Yeah.
Did they mention any formula used to calculate the sample size, or no?
No.
I don't think it was justified, was it? I wouldn't say it was justified. They've just stated it, haven't they? Yeah. And the excluded was for the missing data, but I can't remember if they had like a cutoff for how much was missing, then they excluded it. Did they do that? No, okay.
Nope, they just said
they just
missing
said
data.
It's been excluded. Okay, good. Well, not good, but good, we're on the same page.
Yeah.
But it's strange because usually reviewers would, ask the people to justify why they've chosen the 614, if this is a sample that they had calculated, if not, did they not meet their target and so on. So it's strange that they don't have such details.
I thought so too. But yeah. Funny. And I also thought if, 118 that didn't have complete data, if that was a, say, research assistant that came up with those numbers, I dare say they'd be getting in a bit of trouble for not recording accurately enough. Like, that is a big amount missing. I would have liked to have seen some justification, like even if it was just, we were measuring this person and then their kid finished on the Ferris wheel and they had to go pick them up, or, if it was at a fair and that's why it was so high, fine, but give us that justification.
Yeah, and sometimes what's needed is that you compare the excluded versus those who were included, just to show that there are no significant differences between these two groups before you carry on with your analysis.
Exactly. Yeah. So
it's interesting. Well, I was just wondering, for talking about calculating sample sizes in general. So this is like off topic to the paper slightly, but to think about the sample sizes. So someone had said to me, one of the ways to calculate it would be based on the analysis that you wanted to do and the minimum participants you needed to do that. But I guess that's not the only way of justifying your sample size, or because the power calculations, is it purely in relation to what you're analysing and what you're planning to do with the data, or is there a more kind of general way to look at it? I don't know.
I think that's right. I'm horrible with statistics, disclaimer, but I know a biostatistician that I have on my supervisor board will say as well, without doing the big power calculations, you can say that in general, a sample size of over 1,000 is generally going to be okay. So there are also, I guess, them rules of thumb.
Yeah, okay. Yeah, that's what I was wondering. Brilliant. Thank you, Bonnie.
But it also depends on the type of population you're sampling. So if it's a marginalized group, hard to reach, then you might have exceptions and you don't really follow a strict formula per se or power calculation.
Yeah.
You go through snowball effect and so on.
Yes. Yeah, that's a great point, Carmel.
Which is again where I'd love to just see what's your population group that you're looking at. I assume it's the general public, but give us something.
Yeah, without saying, it's difficult.
So I guess that moves us on pretty well to whether the reference population were clearly defined, which I think I've already shared my thoughts on. So if anyone else wants to go, please do.
Happy to agree. No.
I even thought just down to, in some settings, you could rightly assume that everyone's community dwelling, like that they live in housing, but it's not unreasonable to assume that, say, a group disability home or an aged care facility might be bringing their participants to the state fair. Like, I think it's a setting that a lot of different people could be at. So I would have liked to have seen, again, just a bit more specificity in what population they were looking at.
Yeah, because they don't include that either in their characteristics table about where they're living. So yeah, it's another thing that we just don't know.
No, and like this is because this is just the only inclusion criteria we get. There's no participants were excluded if they had, whichever conditions or terminal illness, or they weren't able to give informed consent. It just raised more questions for me than it did answers. And I guess keeping in the theme of the population, I got really curious about the Minnesota State Fair, since that's literally all we know about this population.
I'm loving that image. That is amazing.
Yeah, so hopefully this gets across that, I don't know about you guys, but when I hear State Fair, I think in Australia we'd probably call it a royal show, but like a really small kind of agricultural fair where people bring their knitting and like there's a cake competition and it's just really small and cute. I don't think a gigantic rock concert with thousands of people. So I would have liked to have seen a bit of a description of what the Minnesota State Fair is, because it also cost $16 to get into, which made me question how diverse.
Absolutely. I'm so pleased you looked into that, Bonnie. That is brilliant, because I'm exactly the same as you. I would not have been picturing that for the state fair, and the fact that there's a charge to go in as well. Yeah, no, that's a massive important point to consider about who they're
Does it mean that they're expecting a younger population rather than older people? Is it something?
Well, that's what I was wondering too, Carmel. And they just don't seem to give any information, which made me think, if this is a big event, I have to imagine that Minnesota would put out some sort of demographic report every year or something like that they could use to compare their sample to non-responders. And the other thing that I did see was that it happens on a public holiday weekend, which made me question, are they going to get more people that work in offices and can have that long weekend off, rather than essential workers that are still going into work on those days? So I just wish they'd spoken about the fair more in the paper.
Yeah, I think it tells us a lot more. Well, it's really good that you just did that digging as well, because we could have really assumed quite a lot about what that event was and where they were collecting the data for. So like that's really brought to my attention actually to make sure that I'm searching to see what they're providing and what else I can find out about that, because I think that's brought up a really important point.
Yeah, not the small agricultural fair that I was picturing. Sorry, you go, Carmel.
I was wondering which journal they published their paper in. Is it a high index or?
Yes, it was the Journal of medical internet research, which
I think it's
I
a very
hadn't
good
heard
journal.
of, but apparently it's
I think-
quite good for health informatics and like digital health literacy. So
It is,
Yeah,
it
I've
is
heard
quite
of
a
it.
good journal. I read it all. I read it a lot.
there you go.
I'm just asking because it's a bit strange that they didn't point these issues out, right? I mean, it seems like the basics of presenting, how you collected the data, whereabouts you were to collect this data, and so on. It's strange that the reviewers let it pass.
Yeah, it's very odd, isn't it?
It's a really good point because other papers that I've seen in this journal have had open peer reviews available as supplementary data files so you can download, so you can see exactly what the peer reviewer said, how the authors responded, and there's an audit trail. But with this one, I can't see that there is any peer review attached to it that you can read.
Because I think they ask you whether you're willing to share this information or not. It's the author who picks, you know.
Yeah. And even when you look at the preprint, because there is a preprint version, but that also doesn't make available the peer review. So it would have been really interesting to see what the peer review said. Yeah.
Absolutely. Yeah, very interesting. So the next question was what the selection process was like, which I think we've kind of spoken to. We don't know what the specific recruitment was within the fair. We don't know much about the fair. We don't know whether they were hanging out in a section where you had to pay to get in or whether they were out the front where anyone could be there. We just don't know a lot about it, and some more details would have been good.
Bonnie, did it say how many people, like how many researchers were collecting that information?
I don't think it did.
No, I don't think so either. Like if it's a team of people or... No, I don't think so either.
No. So, I mean, it says they got a little backpack after they did the survey. So I have to assume there's at least one staff member on there and it's not just an iPad in an empty field, but yeah, not many details given. Any other thoughts?
I'm just wondering, what is the target population? I mean, okay, you mentioned they don't mention such a thing, but who goes to that fair? Is it representative of the Minnesota population, or so we don't have such information either?
I would have loved to have seen that, and like looking at how big that event is, I have to imagine that the people that run it have already made those sorts of comparisons, and it would have been pretty easy for these researchers to get their hands on because, yeah,
and
much like you.
Yeah, sorry, and sometimes it's possible that they would receive visitors from other states, or this also is important to consider.
I was thinking exactly the same thing. Yeah, if it's a big event, it's going to be attracting people from all over, isn't it?
Yeah. What's the exclusion criteria? Is it they have to be in that area, that state? It's, yeah, not many details given. Keeping in that population theme, non-responders, I've put up this little excerpt, but really they don't tell us anything about people that didn't respond, only people that have put in missing data that didn't answer enough, which again, I have to imagine there's readily available demographic information about either Minnesota as a state or this fair in general. Would have been nice to have seen something, even if it was just a sentence saying it's fairly representative. What does everyone else think?
Yeah, the same. And I think talking about where is it? Have a smartphone, computer or tablet. I think you're going to get a higher percentage of those that feel comfortable to complete your survey on an iPad. Like my mum wouldn't do it because my mum would be like, I don't know. My dad wouldn't do it because he wouldn't have been at that fair. Do you know, you're missing quite a lot of those other people that you probably do want to hear from.
It seems also that there is a statistical difference between those who took part and those who were excluded, right?
Yeah.
Yeah.
Which it just makes me go, why? And yeah, much like Sam was saying, I think even if there was a staff member there at the iPad guiding them through the whole process, some people, iPads still just look scary and they probably won't engage in a survey like that. I would have liked to have seen a more detailed recruitment strategy.
Yeah, definitely. And because I think to be able to do that, to say, oh, we had another researcher who had it on paper, or like just some other alternative ways of collecting it. If they just explained it, it would have been really useful, really helpful.
And I don't know about US geography, and this would probably be where it would be good if US people, if you're watching this recording and you want to chime in, please do. But I know a lot of other papers published in the US, they'll go out of their way to make sure the survey's doable for Hispanic speakers. And again, there's just no statement of how they've accommodated people that aren't tech savvy or don't speak English or any of those sorts of things. Just would have been nice to see a bit more info.
Definitely agree.
So this is the measure they've used for health literacy. I've got the other measures on the next slide, but I thought health literacy is the main interest for this group. So what did we all think of this?
Was this the bit that's on the 5-point Likert scale? Yeah.
So these are self-developed items.
They're developed by, I've got it on in 2 slides, but it's developed by someone, but they didn't really justify why they chose this one in the paper. I didn't feel. Usually say, we chose this instrument because it's reliable or because it's valid, and they sort of just said, this is the measure we used, and that's it.
Yeah, it says the items are from the Behavioural Risk Factor Surveillance System questionnaire developed by the US Centers for Disease Control and Prevention. And they leave it there.
So they picked these 3 items out of a bigger questionnaire, it seems.
Yeah. Yeah, they don't say why. Yeah,
and I think that surveillance survey is quite like a national one that could be seen as pretty reliable because their methods are pretty good and they have like a huge sample size and questions are all, developed by expert. But again, just put it in the text, justify your choice because there are so many health literacy tools out there now. I feel that most papers should be stating why they chose X instead of Y, or...
You're right, but this doesn't seem like a tool. It seems like they've picked, they've selected those 3 items out of a larger scale, and this you cannot normally do. Because you have to test for reliability and validity and all those things. Strange.
I'm not sure whether, again, they were so unclear whether this is a health literacy section of like a larger questionnaire on health behaviours or whether this was a subsection of the health literacy section. It's just so non-specific. But looking at it at face value, what do we all think of these 3 questions? And do we think these give a good measure of health literacy, or what are our feelings around that?
I don't know whether I'm just being dull, but it doesn't really address the online aspect. So it just kind of, I don't know, like, yeah.
No, I agree. And I don't know whether you had this thought as well, Carmel, but I was kind of thinking, why didn't they just use a measure of e-health literacy? There are plenty out there.
But if we're to take the author's side, it seems like they picked those 3. The last one is whether they understand the written information. The top one is whether they understand any advice, or probably verbal, right? So it seems they tried to take different aspects in those 3 sentences.
Yeah, I think you're right, Kamal. That first one is about the accessing, maybe the information. The second one about understanding, and then the third one is they've put a little bit about the internet, but it's got the other bits as well. So maybe they think those 3 together give them everything that they're looking for. But I don't know. It seems a very quick snapshot of it, I suppose. It's the minimum maybe that they thought they could get. Because I don't think it tells us how big the survey was or how long it took to complete for anyone either, because we don't know how many. No,
could have been 5 minutes, could have been an hour.
We don't know. Yeah.
I have to say, the only other thought I had was that I've sometimes read similar questionnaires to people, and with the self-report can get a bit messy in my experience. Like, say that first question, you might get an answer of, well, I don't find it difficult at all because I actually don't want any health advice. And then technically that person has given the most health literate answer, but it's because they don't want health information. It's messy.
Definitely. And that self-reported bias where you just say what you think the person wants you to say. That I'm really great at it.
Yep. Any other thoughts, or should we look at the other 2 main measures in this one?
Yeah, let's have a
we
look at
understood from you that we don't have the total number of items in the whole questionnaire.
No.
We don't.
It would be nice to know, wouldn't it? Even just an average for how long it took to do the survey might give us some idea. But so these are the 2, I guess, more internet-y ones. What did we think of these? I can start if we like. They did mention it as a limitation, so they've acknowledged it, but I don't think this health-related internet use items really discriminates against different types of information seeking, which I would have liked to have seen, just something in, like, I would say that's almost the skill in e-health literacy, appraising different sources of information and using critical thinking to work out which ones are the most reliable, or, moving it into the real world and bringing up those sources with a health professional that you trust. And I'm not seeing any of that in the description they're giving here. What do you guys think?
So did they, with the total score of 12, so do we know how many, was that 12 questions?
I think so.
Okay,
and
and
it's
they're all
weirdly
those
worded
binary,
sentence, isn't it? Because it could be that 12 is the total score, or it could be that there's 12 items in
Yeah,
the questionnaire.
yeah,
It's a bit clunky.
yeah, it's not clear.
I'll be
like
honest
you said,
here.
it's 12 items, and then they asked them whether or not they had used it. So this is the binary outcome, whether yes or no. That's how I understood it.
Me too.
Yeah.
And I thought it probably leaves something to be desired. Like, I don't think just how much you use the internet is the only measure of someone who's e-health literate. I'd say there's lots of other measures, like, is that internet use where you're just looking up information yourself, or is that engaging in telehealth? Because they're two very different modes of internet use, and one is probably more desirable than the other. And, you know, what sources of information, how you're looking at it, lots of things. Any other thoughts? I'll move on then, because this is where those instruments were taken from. As far as I can tell, the health literacy and the internet use items were taken from sources, and then the binary, do you use the internet for health information? They just came up with that question themselves. Did everyone else sort of think similarly? Yeah. I thought like we discussed with the health literacy one, just a bit more justification and how they extracted that from the survey. Was it just a section? Was it, yeah. Any other thoughts?
I was just thinking about the title of the paper and how it has that emphasis about information seeking behavior online, and that's what makes me again think about, well, why aren't you questioning about like the e-health literacy? Why have you not chosen to go down that route? Because the title really gives you like this feeling that it's going to be about that online information accessing, that critiquing the online information you're finding, but then it's like they've used different measurements that aren't really giving us what, but then their aims don't really match the title either, because the aims didn't talk about digital health literacy. It's just not quite joining together, as it's not kind of flowing as in the direction.
Yeah, what I felt they did is they asked those 3 questions about general health literacy, and then they asked just one question, whether or not they use the internet for information. And I think those who said yes were asked about these 12 health-related internet use items, and the others probably did not have to answer this. I don't know if this was the case or not, but it seems like the point 2 is the one that differentiates between the people who used the internet and those who didn't. I'm not sure if in the analysis it shows this way.
I think they asked it to everyone, but again, it's one that they're just not clear on. They just were really vague when they described it. And yeah, I think the other thing that popped up to me was that
everyone in the study, even those who said they did not use the internet, had to answer those 12 health-related internet use items?
I think they might have, but they didn't speak to it very much, and they, not very clear when I read it. Any other thoughts on this one? Other than that it's messy and that they should have been clearer. I might move on to an easier one then for us all. We all happy with the 5% statistical significance criterion? Good. What did we think about how detailed the methods were? I think it kind of just comes back to what we've been describing. I thought the statistical analysis part was probably the only part that was detailed enough.
I was just going to say, in the results table, they've got the 12-item health-related internet use, and it does look like everyone has had to answer it because they've got the total number at the top, and it does look like it's included everyone.
Which is pretty, I don't know, it just strikes me as strange if you're going to ask that binary question of yes or no.
Yes, yeah, because it's all in the same table, so they've put that one first, and then it hasn't reduced the numbers, it's exactly the same, it's all in one table. So yeah, it does look like it went to everyone.
Then you think, is that why you have so much missing data? Because someone's told you they don't use the internet, and then you've asked them a bunch of questions about the internet, and they've said, I told you I don't use the internet.
Yeah, and then just got rid of them. Yeah, and then just taken those out. We just don't know.
No. But this analysis plan isn't raising any red flags for anyone. We're all happy enough with this?
I mean, my knowledge is limited on it, but it seems detailed.
Same here.
I don't have the quant knowledge to be able to critically appraise it. I really wish I had, but I had to look up I can't say it, but the words begin hetero. I had to look that up because I don't know what that is. And I still don't really know what it is, even after looking it up.
I looked up the Cronbach alpha and 0.70 was the cutoff as acceptable. So they were 0.74, and I'm sure there was another one, 0.78, I think it was. So those were all fine because I double checked that, but I'm the same. My knowledge is not there off the top of my head for sure.
Neither.
It's a measure of reliability and internal consistency. So like you said, the 0.7 is the cutoff. So anything above that is good when you're presenting your research. But it doesn't tell you that it's fine that they picked only 3 items out of a bigger questionnaire.
Carmel, so is it saying about the way people have responded to those 3 questions? That's what it's telling us about the variation between the respondents of those 3 questions?
No, it tells you if these items are measuring the same construct. So
I see.
If you calculate this and you find a wrong or a low Cronbach, it means that these 3 items are not asking about the same thing. Yeah.
I see. Thank you.
Yeah, it's funny, isn't it, that they give that statistic, but then they just don't tell us whether that's the whole questionnaire, part of it, why they chose that one. But if we're all generally happy with the analysis they used, move on to results. And obviously can't fit the whole results in one slide, but what did we think of how they reported it and what the results were? I can start if we like. I was generally actually pretty happy with this section. I thought they did pretty well and left the discussion for the discussion section. Everything was easy enough to follow along, and they had lots of tables and it seemed like they reported on everything they should have pretty consistently. So I was happy. Did anyone else have other thoughts they wanted to share, or are we happy to?
I'm happy to move on. I think the only thing that we mentioned earlier about missing from the socio-demographic characteristics would be their living situation, if they were community dwelling or where they were. I think that would have been an interesting one when they talk about the socio-demographic characteristics. I think that's about the only thing that I think, oh, that would have added something to it that was maybe missing.
Agreed. And even the fact that they measured whether people were married, divorced, or never married, but yet, so it's like they're acknowledging that that's an important thing in how someone interacts with their health demands, but then they didn't measure whether someone was actually living alone or not, I don't think, which to me would be, well, if you care about whether people are married or not, might be worth just how many people in your household, because in my experience it can make a difference. But yeah, a bit more socio-demographic things would have been nice.
One of the other things that I'm pretty sure comes up in the HLQ is around does somebody support you? I can't remember the exact wording, but it's about, does someone else help you get
had someone
that help?
helped you fill in this questionnaire?
Yeah,
Which again,
yeah,
were they completing on an iPad in a stand on their own? Were they being talked through it? Were there different people that, because I know sometimes when I've done verbal questionnaires with people, some people will be like, no, I can read it.
Yeah.
Or others just sit back and let you read to them. It would have been nice to know some sort of level of engagement.
If someone needed translation, like there was someone there that helped them, did they have a child there or did they have someone else there who was helping them? That little bit of information would have been really useful to see the breadth of their engagement.
Any other thoughts?
The findings, I just wanted to mention that their findings seem to go in accordance with the literature, except I would say in certain contexts like ours, and you don't see a difference by gender. But I was surprised not to see age. It doesn't say, because age would matter in terms of health literacy.
I think they had it in their table as being significant, and like you said, Carmel, it's another stat that just fit in really well with the literature. So I did think that was a funny choice to not talk about it in the results, because they then do talk about it in the discussion. Yeah.
Oh yes, I was about to say where is it, but I found it now. I was wondering what the ages were, but I found it.
And I found their age finding really interesting. So even though it's there, it would have been nice for it to be in the text of the results as well as the tables. But we happy to move on? So non-response bias, I think, just comes back to that thing of we don't know who their non-responders are. They haven't described them at all, and it would have been really nice if they did, because even though they haven't described what population they want, I think we can all kind of infer that they just wanted a general community level of health literacy. And I think whenever you're doing those sorts of general population studies, it should be something you really strive to, having a population that are really representative of your population of interest. But what do you guys think?
I think that's really true. And I think the sample size, the fact that that hasn't been discussed on why that was the number or what they were aiming for, is something that's quite integral to how we interpret the results.
I think also maybe they did not have a way to describe the non-responders if they were not present there. If it was just the iPad, then there's no way for them to provide additional information. It's just a thought, because you said they don't mention whether they were physically there or not. So yeah.
That level of detail would have been super handy. And again, just a basic demographic profile of Minnesota or the state fair, if there was one, would have been awesome. Same thing. Did you guys have any thoughts around this one? I think it just leads on from the last one. We'll move on then. I couldn't fit all the results on one slide, but I thought they were generally pretty internally consistent. They sort of just, I mean, I don't think they really dwelled on results enough to contradict themselves. They sort of just mentioned everything once and then moved on to discussion, which is fine. But yeah, I didn't have any problems here if you guys didn't. As far as I can tell, everything they said they were going to report on, they did report on. So again, if you guys are happy here. Cool. What did we think of the discussion and the conclusions that they came to? I've just copy pasted. This is their conclusion. I kind of thought they missed a good chance to delve a little deeper into health literacy. The whole thing kind of seemed to me of just, here's what we found. These are the groups that had lower health literacy, and that's it. It would have been nice to have seen a little bit more, I don't know, putting it in the context of, yeah, just how people respond to the health demands of their life and how, you know, world's getting more digital and it's really important that these groups don't get left out, or just anything like that. It just kind of seemed a bit dry to me. What did you guys think?
I was just thinking, did they define, you know, that it says this study found that better health literacy. Did they have a cutoff point of what they said was lower and what was higher, or what was better and limited or something like? They didn't know. I didn't think so. So I think that's interesting. Yeah.
And again, like I can assume, maybe it's that 1, 2 were low, 3 was medium, 4, 5 was high, but they just don't specify it. Sorry, what were you going to say, Carmel?
Just wanted to ask if they've detailed in the discussion, you know, all their results and explain how come they found these results, or they didn't go through that.
They did. I thought that was something they did fairly well, like they summarised everything well, but I think they just then didn't take it that next step further into giving a bit more context and why those results are important, because I think it is an important study and they haven't spoken to that very much. But what did you guys think?
I was going to ask Bonnie, can you talk us through the age thing? Because I didn't read that. I can see a bit here about decreases between the ages of 38 and 71, but I can't find the younger bit of it. Do you know, can you remember that?
Yeah, so I couldn't see too much either, other than that part in the discussion, which I thought was interesting as well, because again, I would have thought it'd be something that they might want to talk to a bit more, but I'll drop that in the chat just in case anyone doesn't have the paper right in front of them. But that's the part we're talking about, which to me would have brought up some really interesting questions about health literacy across the life course, and, you know, is that an opportunity to, you know, possibly plan interventions for people between 38 and 71? And why is it that that age group are lower? Is it because they have busier lives? Is it, yeah, I don't know. It just seems like they sort of mention it and then move on.
Yeah. So in the, you know, where they've put it's table 3, basically, multiple regression analysis, and it's got the variables for age 2, age 3. So I don't know, and I'm just assuming. So they haven't said anywhere what the lowest age of respondent is. They've just grouped them into categories. So age would have been, oh, perfect. Age would have been, I don't know, whatever, 18 to 25, and then age 2 would have been 26 to, is that right? But we don't actually know what the lowest age respondent was.
No, correct me if I'm wrong here, Carmel, or anyone else, but I think what they've done is they've taken the age and they've done regression, but then they've taken it and squared it and done it again, and then cubed it and done it again, which is fine. Like, I think that's a valid thing, a valid way of doing analysis, but they didn't really explain why they've chosen to do that in the methods.
So they've put all the ages together, every respondent. Oh, okay, that's, yeah, I didn't know.
Yeah, they just don't really describe it in the methods as well as they should, in my opinion.
I had no idea that was a thing. Okay, I've got so much to learn.
Are we all happy for me to go back to the PowerPoint? Cool. And then for limitations, obviously we've brought up a whole bunch in this discussion, but what did we think about how they've addressed the limitations of their study? I can start us off if we want. I think, look, I think other than the things we've discussed, they did okay with the word count. I would have just liked to have seen a little bit more. Yeah, I suppose if they had a lengthier method section, I would be happy with this. It's just, yeah.
Diana, can you hear us? I'm not sure. Okay.
I did like that they addressed a few things I had been thinking through reading it, especially that point at the bottom about not all online information is good.
They mention also the fact that they couldn't reach a fully representative sample. So we're not sure what they aimed for, but they couldn't quite reach it.
Agreed. And it would have been nice, I think, if they could have weaved this more into future implications and said, you know, in the future, maybe a better sample could be this, or, you know, maybe a better questionnaire for health online would be something that talks about the different sources. But, you know, I'm guessing they had a word count to stick to, and I think they've brought up major limits other than the ones we sort of have discussed here. But any other thoughts?
I was just going to say, I thought it was really interesting, Bonnie, that you mentioned earlier about how it had already been cited by a few papers already. Do we have any idea why, what it is in this that people are, that's kind of novel, or a reason why people are citing it? Is there anything, Bonnie, that you thought this might be why?
There's nothing that stuck out at me, and I didn't have time to look through the 3 things that cited them and see why, but just for everyone's reference, these are the 3 that cited them. It did make me question whether maybe JMIR are just really big on internal citations, because I know some of my colleagues have gone to submit to other journals and they say, oh, we want you to cite this paper that came out in our last edition. But yeah, seems like it's getting picked up by other articles. Go back to sharing my slides if we're all happy with that. We all happy with the limitations? Cool. As far as funding goes, I thought it was a pretty normal funding statement. As far as I can tell, the Masonic Cancer Center at the University of Minnesota is just a large university hospital that does a lot of cancer research. It didn't seem like it was... They didn't really go into much detail on how they're funded, but it didn't seem to be an overtly religious institution or anything like that. So no red flags from what I can tell. But any other thoughts on you?
No, all sounded fine.
Good. And ethical approval. I just really would have liked to have seen some more talk on informed consent and what they deem to be informed consent.
Do you know what, the other thing that, when you mentioned that earlier, it made me think about alcohol consumption as well. Like when you put that picture and it was more like this rock concert thing, it made me think about alcohol and consent as well. That did cross my mind.
Yeah. I think that's my biggest gripe with this article. I just would have liked to have seen a more detailed method section. I think a lot of my questions would have been answered if the aims and the methods were more fleshed out. And then I thought, just coming back to the abstracts now after we have discussed the paper at some length, do you all think this is a fairly good representation of what the article is? I thought it was pretty good. I mean, you're never going to be able to perfectly distill something down into an abstract, but I thought they did a pretty good job. It's fairly representative of the whole paper.
Yes, agree.
Cool. Did anyone have any thoughts on anything that just hasn't come up, or any feelings, or...
Oh, I thought it was a really great paper to discuss, and I really liked your reasonings, Bonnie, behind choosing it. I thought that was really useful and a really great way. And also I love that you went into that a little bit deeper to find out what this community fair was, so that we could get a better understanding, because I think that it could have, if we didn't have that piece of information about what it actually looked like, the state fair, I think our discussions could have got a different way. So I think that was really useful that you did that, and it was a great way to make sure that our discussion we just had a clearer picture of actually where they were recruiting from. So I think that was really useful.
Good. Yeah, it certainly wasn't the little old ladies sharing their, quilts or whatever that I had in mind. So, and I'm sorry that it wasn't necessarily like, oh, this journal, like this article's amazing. Oh, that's something that I'm going to use in when I try and write up. But I thought it hopefully generates some good discussion. You know, sometimes looking at the not so great journal articles can be just as good at looking at the really amazing ones.
Yeah. Oh, I think it's brilliant for helping me know what I need to do when I'm creating my research as well. And having people who are more experienced and thinking about things in different ways, it's like, oh, I wouldn't have thought of that, or that hadn't crossed my mind yet. So it really helps stimulate those thoughts about how I can be a better researcher as well. So I find it so valuable.
Yeah, definitely. Me too. There's so much that I don't know about quantitative research. So I found this really valuable, like just as Sam said, very helpful.
Sure. Thank you very much for a great discussion.
Thank you. And thank you for being here with your more quant expertise, Carmel, because otherwise I probably would have been looking at the stats going,
But the whole time I was wondering, how did this article go through the review process? I mean, just us discussing here, and we felt there are many things that could have been improved. It just makes you wonder, because sometimes you have horrible reviews and you have to repeat everything you've done, and here it just goes by so easily, it seems. I don't know.
Yeah, I did kind of read it. I mean, and this is me like not knowing anything about quantitative stuff at all, but I listened to a podcast which is something like how did this get played, which is about video games which aren't very good. You know, how did they
I think my partner watches the movie equivalent.
yeah, and this just kind of reminded me like of this, really, like how did this get past peer review with, you know, with all the things that we have sort of found in it. Yeah.
I wonder as well, just to be a fly on the wall when these researchers approached the state fair staff, because I don't know if you guys have ever, I just feel when you go to an organisation and you say, I want to collect health literacy data in your space, you normally need to have like a really compelling story and be able to like really, really justify why it's so important and kind of be able to show that you have all your ducks in a row. And to me, this just didn't seem like they had all that and there wasn't a crystal clear plan.
I'm thinking, do they know someone who works there? Did they get in that way? It's the same as I imagine doing something like that down here, and I think there's no way you would get past all those levels of, well, we don't really want that, doesn't really fit our vibe of what the event is. But if you knew somebody that was there, they might be like, oh yeah, you can come in for a bit and collect for a couple of hours.
That's such a good point. Like I have faced so many barriers just trying to be allowed to collect data. So yeah, I would have loved to have been a fly on the wall as well.
And even just the university, like I have to imagine if I ever went to my uni and said, I want to collect health literacy data at an event where everyone's going to be drinking or that there are going to be small children around, they'd be like, haha, no way.
Yeah, I wonder if maybe they had like a University of Minnesota stall or booth where they were encouraging people to like get a prospectus and stuff, and they kind of latched onto that. I don't know.
Well, that's a good point. That's a good guess. Yeah. I'm really sorry. I'm going to have to go because I've got a meeting weirdly at 9:15, a funny time. But it's been so great to see everyone. I've really enjoyed it. Thank you, Bonnie, so much for presenting. It's been really, really interesting. So thank you, everybody.
Thank you, guys.
Bye-bye.
I wanted to ask you, Bonnie, but I haven't got time now. I would love to know more about, you know, when you started just thanking the ancestors and setting that tone. I love that. And I would just love to hear more about the kind of the process behind that, but I will have to save that for another day.
Sounds good.
Yeah.
Lovely to see you all.
Yeah, take care.
Diana just joined us, or?
I'll see you all at the next one and
Yeah.
chat soon.
Thank you so much.
Excellent.
Thank you.
Bye-bye.
Take care, everyone. Bye.
Bye.